Um, so this afternoon, we're really fortunate to have Janet Bartlett, who's a well-being specialist in the Office of Learner Wellbeing and Success in the Faculty of Medicine, joining us. Many of us will know Janet through our teaching the first-year communication skills course. Janet worked with community health and helped to organize the rural visits and the debriefs and the write-ups being corrected by us or marked by us. So she's a familiar face to many of us, and we're happy to have her presenting resident resources today. So she's going to give us an overview of supports and services and resources available, and the insight into how the processes to create these resources was done. Okay, so I'll pass it over to you, Janet.
Thank you, Vina, for that lovely introduction. Yes, I have been here for a number of years, and I guess, maybe some faculty are wondering about the transition to learner well-being, but honestly, when you've worked with medical students for 35 years and develop informal relationships with them dropping by the office, my interest has always been in medical well-being and distress. And in fact, that's the master's work that I did here in medicine. So after I retired, this seemed like a natural fit for me. And so I'm learning more and more about the resources and hoping to share with you today. So thank you for that, Vina. All right, let's get started. So I hope to cover in this session today some information on wellbeing resources for the residents, and that includes wellbeing contacts here in medicine, but also support services outside of medicine, information on accommodations and accessibility for learners that may require medical accommodation or support in the learning environment. I'll briefly touch on the mistreatment policy just to let you know where residents can go for consultation. Highlight some national physician resources that I'm sure many of you are familiar with, and just share with you our two-pager, which I will share with you again after this session. And it's kind of, it's a quick reference guide really that will include most of the pertinent information from this presentation, as well as our resource guide, which gives a list of various presentations and workshops that we can offer to any of our programs. So my role in the Office of Learner Wellbeing and Success is to provide residents and programs with guidance on wellbeing resources, as well as referrals to primary care, could be referrals to counseling, also to help facilitate assessments for any type of medical accommodation. And we'll talk about that in a moment. Residents can also reach out to our office if they need guidance on any of the resources, how to access a family physician, how to access counseling. We offer a safe space here for the residents, so their privacy and confidentiality is protected, much like your relationship with patients, unless there's concern for harm. Then I would need to reach out to additional supports. We also offer guidance on financial information on debt management, investing or buying a home. We can also offer to programs sessions on opening a practice we can arrange for residents. We also offer consultation on mistreatment. Now this may be changing in the future, particularly through accreditation, because our office really should be at arm's length from mistreatment complaints, but we will still be involved in developing a process, and when that's updated, I will share that information with you. It's more likely that that will be handled through a branch of the Dean's office in the future, but for now, we are still the main point of contact. I just want to add, if anybody has any questions at any time, don't hesitate to interrupt me. So we also have for you access to a postgraduate faculty wellbeing network. So this network was originally formed by Dr. Stockless, who's now the Associate Dean in our office, and it consists of a faculty representative from each of the programs. In your program, Dr. Heather Flynn would be the contact, as well as a resident graduate. And so we work together in this network to identify resident wellbeing needs, It helps to facilitate communication between our office and the disciplines, and also to share information and resources. So this is another excellent network that all faculty have access to, and residents. If you wanted to reach out to somebody, perhaps who is not the physician lead in your region, or maybe you don't wish to speak directly to the program, then you can also reach out to your well-being rep on the network. And this is a little diagram that just shows all of the contacts across all programs. You'll see family medicine here. And it's just a quick reference, and another great tool for actually tackling well-being challenges and successes. We also share our successes in the network, but it just has really helped to enhance communication across disciplines. So it represents a unique opportunity for you to communicate any concerns that you may have, or even just sharing information or resources. This process map, I know it looks really busy with all of the lines, but just take all of that out of the equation. It's really just to show you who some of your main points of contact are very quickly. So for the resident or for a preceptor, if you have concerns about a resident, you may wish to reach out to your regional lead. You may wish to reach out to your program director. You can also reach out to me, as can the resident, because they can also self-refer to any of these services. They're not required to come through our office, but we have found, particularly with any situation that's time sensitive, that I can actually help facilitate things much quicker. But of course, not everybody's comfortable coming forward. They may wish to self-refer. So, and we will talk about all of these contacts now shortly. So now we're getting into the meat of it. For distressed learners experiencing an urgent or emergent situation, as you all know, if it's an emergency, call 911, head to the nearest emergency department in your area. This is the information for St. John's, but of course we appreciate that for students out in the regions, it would be the emergency department that's nearest them. 811, of course, you're all familiar with this line as well. If a student wishes to reach out to a registered nurse to discuss, whether a situation may be urgent or emergent, they can do that. But this is also the number for any type of mental health intervention. So for any learner that's in the St. John's area, of course, we have access to the mobile crisis response team. You would not have this in regions outside of St. John's, but it's still a number to call, and they can connect you with immediate resources in your area. And of course, this is the number for suicide. If you need guidance or support, or you're concerned about someone who you think is considering suicide, this is a quick number to call, in addition to 911 or 811. I'm sure you're all familiar with this information. This presentation is developed so that it can serve both residents and faculty. So there may be some things in here that you feel is redundant, but that's okay. No harm in a refresh. So now we're going to just briefly discuss some of our MUN supports. And I've broken it down by on-site, off-site, etc., because it's just easy to remember the resources that are available that way. So the MUN Student Wellness and Counseling Center is really a one-stop shopping for all of our learners, but in particular our residents. They have access to both physical and mental health care. The team includes a number of family physicians, as well as nursing support. And we are currently awaiting a psychiatrist. They're hoping to fill this position by next fall, which is really important for us because it was the psychiatrist who was initially providing us with mental health assessments for our residents and providing support for medical accommodations. So at the moment, I am arranging for private assessments, and we can chat about that in a bit. So if you have any questions about that, you can reach out to me directly or your program director, because I do work very closely with the program directors to help facilitate these processes. So residents can email the front desk at the SWCC. They can't book appointments that way, but I have included the information here for them to call, and they can book appointments directly. Typically, the wait, it can be a week, it can be 2 weeks out, but the SWCC also has what they call a quick fix clinic. So you can just literally walk in, and that's more for lumps, bumps, prescriptions, quick things that need to be filled. For residents who prefer to have more continuity of support, they can request the same family physician in the SWCC to be followed. I will discuss the NLMA MD link in a bit, but this is what we are recommending right now for our residents in terms of securing a family physician in the St. John's area. Now, they do also offer virtual appointments, but for students in the regions who prefer to have the in-person, they'll be working directly with the leads in the area. And I can talk to that when I get to those slides in the regions. In terms of counseling services, they also have registered clinical psychologists at the SWCC. I do also help facilitate those appointments, but residents can book directly. I do find when I intervene that I can make things happen a little quicker, so that's good to note. They have access to, so the 8 sessions I see what that is, that's independent consultation with a clinical psychologist, and they are limited, but they do have unlimited sessions with the wellness counselors. So those are more solution focused and wouldn't involve any type of psychotherapy or treatment or anything like that. In terms of the mental health or psychoeducational assessments, the counseling center was providing those. That's on hold at the moment, not available. But for any resident that's requiring that, I can help them set that up privately. We may have access to funding to support them because their insurance typically only covers about $500 for those assessments. But that's something that we can work with them on if any residents self-identify. And of course, the counseling center also supports GuardMe, which is a 24/7 real-time. Learners can call. It's offered in 60 languages, and they can access counseling support through these numbers. Also through MUN supports, we have access to the Blunden Center. The Blunden Center provides accommodations related to academic support. So this is to, in particular for learners that may have any type of vision or hearing or visible disability, but also for mental health or learning challenges. Blunden is the route that we would go if we wanted to access academic support for students. So this would be strictly for academic accommodations in like extending an exam or requesting more time for academic activities. This does not include a workplace accommodation. That's a separate process that I will discuss when we get into the NLHS services. So some learners still do access this, even at this level, because they do write exams and they do still have academic activities they participate in. So this is also an important step in their assessment. And I can provide information on how learners can access this. Anybody can. It can be temporary. It doesn't have to be someone with a visible disability. You might recently have had surgery, for example, so maybe you need a temporary accommodation. Then we can provide support with that as well. Now, Blunden doesn't provide the assessments. So a learner who books an appointment with Blunden would need to provide their own documentation or assessments. So if it's a medical accommodation, then certainly the learner can have their physician complete the paperwork. If it's a mental health assessment, then that's something I would have to help set them up with because Blunden doesn't provide that. And if you have any questions about that, you can reach out at any time. And they can simply contact Blunden directly by calling the number here, by texting, or by emailing. As students, residents also have access to a number of resources through PGME. They may be looking for information on policies and procedures, important dates. They may be looking for information on program transfers, and they're not sure who to go to, or maybe they don't want anyone in their program to know. This is confidential through PGME. But if they have any concerns about reaching out to PGME directly, they can contact me and I can connect them directly with the appropriate person in the PGME office. So while PGME may not seem like the first point of contact for well-being, they actually do provide a pivotal role in supporting residents, because they would support them in any type of accommodation in the workplace. They're part of that process, so they support the program directors, they support us. They wouldn't necessarily need to know any of the medical information, but they do play a key role in supporting the residents. Now, as employees of NL Health Services, residents and physicians also have access to a number of supports through NL Health. So what I have done here, just for simplicity of today's presentation, is I've included all the information from across the regions in one slide. This is how I actually presented on the two-pager that I will share with you after the presentation. I do have a separate slide for each region that does give more detailed information, so that when I share this presentation with you, you'll have that. But just for ease of presenting today, I thought it would be better to include it all on one slide. So as you will see from this slide, each of the regions does have an employee assistance program that offers access to short-term counseling, to coaching, may also provide e-courses on various well-being topics for residents. Because all of the regions were separate before you amalgamated it into NLHS, there are still some differences across regions. This may change going forward, and if and when it does, I will update that and share with you. But for now, you'll see with Central and Labrador Grenfell, for example, Homewood Health actually provides the counseling and coaching services for the residents. For Central and Labrador Grenfell, they offer 24/7 access to counseling, and they also include family members. For Western, at the moment, just because of the capacity issue and they are not accessing Homewood, they only can provide confidential counseling services to employees. They're at capacity. They only have 2 wellness counselors in the region. This may be changing, but at the moment, this is the current setup. For Eastern Health, you see I've listed EVA here, but actually residents anywhere in the province can access EVA. It's a virtual assistant that's available 24/7 that will connect residents to whatever services are in their area. So whether that's a counselor, whether it's some type of emergency service or mental health support service, they can connect through EVA. On site in the St. John's area, we also have access to the rapid response team. I don't know if you have access. I would imagine each of the regions has something similar in their hospitals, but I don't have information on that. This is when a critical event has been identified in the hospital setting, then the physician lead for that team would reach out to the rapid response team and they could bring in psychologists, counselors, and do a group session with the team. Eastern Health also offers a peer-to-peer support program through EVA. Again, as I said, this may change as NLHS expands the services to be consistent across regions. At the moment, it's only offered through Eastern Health. Now, what follows is, so this is just more information explaining each of the programs for Eastern Health in terms of what's involved in the program. And then I've included a slide for each of the regions. And I'm not going to go through all the information individually with you. It's just to know that you have access to this, and I will share this document with you, so you'll have all the important contact numbers that you need. For Western, as I said, at the moment, it is different, and you'll see that it's also, the service is only offered during working hours. So for any type of 24/7 after hours care, residents in the region would contact the NLMA. And I will speak to the NLMA now shortly. And Labrador Grenfell. So Homewood Health is the provider for Labrador and Central. Now, in terms of what NLHS offers for medical accommodations, they have a separate process from the Blunden Centre, because this would be a medical accommodation that impacts the resident in the workplace environment. So not related to academic activities or, extended time for an exam. This would look more like a resident, perhaps it's a mental health issue, perhaps they've had surgery recently, maybe they need to have their call hours restricted, perhaps a reduced patient load. And this is an accommodation that would be developed with the support of NLHS, with their occupational health team, Dr. Tara Rector, but also typically involves the program director, would be involved in these discussions in terms of, because typically it involves a modified learning plan. Not always, it could be just a simple medical accommodation. But so the process for this is slightly different. They do require that a physician complete this documentation. So it's a functional assessment form that they'd be required to complete, and they would fax it directly to occupational health with NLHS. If there's any questions about the process, the resident can reach out directly to Dana, or again, I can help facilitate the process for them. And I've done that for a number of residents recently. The process is fairly new, I will tell you, in terms of our relationship with NLHS and PGME and each of the programs. PGME is currently working on a process document, sort of to make this easier for people to understand when to access Blunden, when to access NLHS. But typically the simple thing to remember is if the medical accommodation or the reason the resident is experiencing or requesting a medical accommodation might impact their ability to do their job in their workplace, then this is the process that we would follow. And if they have any questions, they can reach out to me. So as I had mentioned, the NLMA is our other support for learners, because as physicians, they're also typically members of the NLMA. If they are not at this point, particularly for any of our learners coming from out of province, I would highly recommend that they apply for membership. And I've included that information here on the slide. They also provide a physician and family assistance program, and this is available 24/7. So if they require support of a counselor, they need to talk to somebody outside of the SWCC hours, or perhaps they're in the Western region and they can't access their counselors there, then I would recommend the NLMA. Would be my next. We work very closely with the NLMA. They have partnered with BC Doctors of Canada, and they also work very closely with the SWCC to ensure that the capacity is there, so that they can make sure that our residents are taken care of. They also offer between 6 to 8 sessions for residents. And for residents who can access this virtually, but they may wish to see somebody on site, they will connect the resident, in terms of they try to match them to the appropriate counselor, depending on what their needs are. So I can also facilitate this process if a resident has reached out and they're not hearing back in a timely way. I can connect with the PHP coordinator and we can get things moving along. Anything that's time sensitive, I recommend that faculty or residents reach out to us and I'll support. Now, in terms of MD Link, this is a service that the NLMA provides for our residents and physicians, but at the moment, they are operating at capacity, as I'm sure you can imagine. Difficulty finding physicians for patients, including our own residents. So if we can encourage the residents to use the family physicians at the SWCC, that's also what the NLMA is doing. If the resident plans to stay in the province and they're looking for a long-term family physician, they will work with the resident to help find them that physician in the region that they plan to practice. But just to know, this is not a quick fix. This is not a short-term solution, for example, for a resident who's maybe gone to St. Anthony and they need a physician. In that case, I would recommend they connect with their physician leads in the regions. and determine availability of family physicians in their area. This is just a little bit more detailed information on some of the services they offer in their family assistance program. So they also offer to family members of the residents. So they have the short-term counseling. They can also refer residents to specialized coaches or therapists. They may have to pay for this particular service just because it's not necessarily covered. And they would have to find out from their insurance provider how much their insurance provider would cover. And I can work with the residents on that if they need some direction. There's also peer support available for residents, and they can match them to a physician that maybe they have particular challenges or particular interests, then they can be matched to somebody who may be able to provide them with the best support. They have some really, really great programs. Of course, as members of Parnell, this is the union for the residents. If residents have questions about benefits or overtime or stipends, vacation, personal or medical leave, and income implications, they can reach out to Trish. I'm sure you all remember Trish Penton, used to work in family medicine and was a valuable asset for many, many years, good friend of mine as well. She's the executive director for Parnell and just a fabulous asset for the residents. So if they have any questions that the programs can't answer, that I can connect them with Trish, they can connect directly, and she can help provide them with guidance on their collective agreement. So these are some of the national wellness resources that I'm sure you're all familiar with, that residents have access to, that provide a number of resources and tools and resilience tips, coping, stress management, all kinds of information available for residents through these sites. I often develop presentations based on information that these national resources have already developed. So just good to remind everybody that they're there, and they have lots of really important resources for residents. In fact, this is a new app. I don't know if any of you are familiar with this, that has been funded by the Royal College. I think they're trying it on a trial basis for a year. So I would encourage everybody to try it now while it's still free and accessible. It's designed to address issues of stress, burnout, anxiety, depression, and it's based on a cognitive behavioral therapy sort of framework. And it's very easy to sign up. You just text WellMD to this number and you automatically subscribe. You'll receive a message daily with just a relevant, I actually signed up for this because I wanted to find out how useful this would be and if it would be impactful at all. And even though it's designed specifically for residents and physicians, I mean, the principles are the same for most of us, right? And I've actually found it very, very, very useful. And most days it also includes links that will take you to relevant documents and tips on how to deal with stress, different breathing techniques, just very, very useful. So I highly recommend it. If you haven't tried it, just try it and test it out yourself. I'd be interested in your feedback. I have presented this to the resident groups. I don't know if anybody has signed up. I mean, we know how busy everybody is, but it's worth it to try it because I'm sure they're going to be assessing uptake and whether they're going to continue with the program. But yeah, it's been very positive effect. I really enjoyed it, I must say. Currently, our office also offers consultation for residents who may have experienced mistreatment. We've recently come through accreditation, as I'm sure you're all aware, and it was identified that our office probably should be somewhat at arm's length from residents reporting any type of mistreatment. We should be here to support them, certainly, if they have experienced any kind of mistreatment or they're having difficulty. But in terms of overseeing the process for consultation or mediation, eventually I think this will probably be moving to the Dean's office, but for the time being, we are still the point of contact. And this is a step-by-step guide of what it looks like when a resident comes in and what they might expect. There's also an anonymous reporting tool on our website, and I've included all the links here. So just something for you to be aware of. And if it comes up and you're not sure, again, just reach out. This is the infamous two-pager that can act as a really quick reference guide for you that covers everything that I've just talked about in this presentation, but also includes all the live links that will bring you to the information. I've actually sent this out to all the APAs in the regions, but I can share it with everybody on this call as well after the presentation, have it distributed. We just recently updated it to include some new information. In particular, the NLHS supports here, which have all been updated. As far as I know, all the programs have also included this, I think, on the D2L shells as well as 145. So we just want to make sure that everybody has access to a quick reference guide because it's a lot of information and we don't expect you to remember it. But even if you have questions about anything here, my contact information is on the first page. Honestly, just reach out. Just reach out. This is just some additional information I included because Bridge the Gap and Doorways really offer some excellent services for individuals who may be coming through any type of addictions or alcohol withdrawal, even bereavement. They've got some really good grief counseling that they offer. So I always like to include that in my presentations. Also included on our website, but again, if you have a resident that has any of these concerns, you can link them directly or you can just have them get in touch with me. Last but not least is our resource guide that we're always updating, but this includes a lot of content that we've already developed that we can offer for any type of well-being academic half day or any type of workshop. And as well, if there's a particular topic that residents are interested in. I had a resident today ask me about interprofessional workplace conflict and having conversations. We can develop the content or we can work with the directors in our office to see if it's something that PGME wants to offer as a PAN program type of workshop. But these are some that are all ready to go if you're interested or if the residents are interested, when they have a retreat. So I'd just like to thank you all. Hopefully that wasn't too quick. I didn't want to get into too much detail with, just listing phone numbers and that. So I wanted to leave enough time if you had any questions in particular about any of the processes. And I will send out an updated version of this PDF. But it's a lot of information. Don't expect you to remember it. I don't expect the residents to remember it. I guess the important thing to know is that we work with all of these external partners, so we have a good handle on how all the processes work. And if you need any information or support, or you want to direct a resident to us, we can help them. So I guess that's the key message is reach out to us.
Great, thank you, Jen. Can everybody hear me okay? I'm just wondering if there are any questions.
Finance, Heather. Somebody's mic, it's kind of echoey. Not so much, hi Janet, not so much a question, but a comment. Having worked with the office and particularly Janet for over a year now, she's just an invaluable resource. I've watched her help so many residents. She is, exhausts all angles and goes above and beyond. So I'm just here to say that I'm very grateful and we're very lucky to have such a dedicated person there to help our residents. So thanks, Janet.
Thank you, Heather. You're too kind.
Thank you, Heather. I was just going to say that as well, that we're lucky to have you in your office to help us navigate these resources, because it is a very robust and looks like there's nuances between the different resources. So having someone to help us, kind of lead is invaluable. Would also be good once the resources are consistent across the province. It seems as residents in Central versus other, Eastern, looks like there may be slightly different offerings. Looking forward to the the 2-pager, because we're all faculty advisors, and most of us are for our residents, and to have something on hand. I imagine the residents have access or have had this presentation or something similar when during orientation, or know of this, you and your office?
Well, word has been slow to get out, Vina, for sure. When programs invite me, of course, I do come in and do the presentation. I've done the presentation once at the PGME orientation, and some of the residents actually remembered me from that session, but it's like most resources that are available. People don't really sort of focus in on resources that they think they don't need. So at the time they may think, well, I'm fine, I don't need any of that, and they don't remember. So it's important to get the word out to all the programs and the faculty, because very often residents, I may not be their first point of contact. They may not even be aware that our office is here to support them, because we haven't always supported the residents, right? That's only been in the last couple of years. It was more the undergrad students that our office supported. So getting the word out there, the more faculty advisors that know about it, the more preceptors, the more likely the residents are to know that we're here to support them. And numbers have been increasing, so word is slowly getting out there. Certainly with family medicine, because you guys are just really good at what you do in promoting resources.
Great. Well, that's good to hear.
Janet did present at an academic half day or last year. And actually after that, a resident did get in touch with you about counseling. So I always consider that our N of 1, that it's working.
For sure, for sure. And there's a number of them. And the accommodation piece is the tricky one, because even the partners that we're working with are still trying to define their own processes, and there are some inconsistencies. So it's important for people not to be working in isolation. So when in doubt, reach out. That's my motto. When in doubt, reach out.
Hi, I'll jump in. Thank you, Janet. It was fabulous. And thanks for all the good work you do. It really matters to so many people. I know some people are present today or were involved with the preceptors planning meeting last year. So just a plea to them to keep something like this at those types of meetings, so that if you catch different people throughout. And I did this to email to Janet, but I'll do it to her publicly as well, to apologize for all doctors everywhere who talked over you at the preceptors meeting and you hardly got a chance to speak. And we all want to hear what you have to say. Fabulous job. Thank you very much.
Thank you, Wendy. You're too kind. I completely understand, because the physicians that were present were very passionate about helping learners. So, and they're on the ground, they're the frontline workers, they're out in the regions working with the students, and they don't maybe have readily access to me like people on site do. So I completely understand.
Thank you, Wendy. Any other questions or comments? I don't think there's anything in the chat. If someone could double check, Wendy, maybe if you could double check.
Yeah,
Aaron Smallwood says,
go ahead.
Aaron Smallwood says that it would be good to have some sort of pamphlet or presentation or booth at each core content.
That's a good idea.
Yeah, I mean, I can share the 2-pager if programs want to get copies printed. We can facilitate that for you for sure.
Okay, we'll take that down and notice.
And Janet, if you're not seeing the chat, there's lots of praise and thank you, and people echoing one another's comments about the great work you're doing and the great presentation.
Thank you. I fear it may have been a bit rushed, but yeah, it was one of those nights where I pulled an all-nighter, and I'm not even seeing patients, so.
Well, you did a wonderful job. Thank you. So on behalf of everybody online here and anyone who's going to be listening to this later, thank you so much again for all that you do, and for this presentation today. It was really helpful. I'm sure many of us will refer back to it, and to you in the future. Thank you.
Thank you. Thank you for the opportunity. Greatly appreciate it.
You're welcome. All right. Thanks everybody for joining, and we'll see you next month.
Thank you.
Thanks.